This is epidemiology and time. Epidemiology has two categories. One, descriptive epidemiology. Those are tools to describe the distribution of a disease across a population or across a group of people. And number two, analytic epidemiology, activities related to finding the causes of disease and biostatistics. Descriptive epidemiology, tools, risks. Tools include risk, prevalence, and incidence, which we'll go on into later in this course, survival time, as well as case fatality rate. Descriptive epidemiology ID general distributions of disease for surveillance purposes, natural history of the course of a disease. Descriptive studies can also do case reports, case series, cross-sectional surveys, or ecological correlation studies. Surveillance, the systematic collection, analysis, and dissemination of disease data, designed to detect early signs of disease, performed at many levels, and this is performed at the local level, the state level, the region, national, and international. Local and state health departments are required by law to report certain types of diseases. Individual practitioners, in some case, are required to report some diseases. This doesn't come up for optometrists very much, but it can possibly come up in the future. Patterns of occurrence, natural history of a course of a disease, the case fatality rate, percentage of a patient who will die from a disease in a set time. Survival time, the average duration from diagnosis to death for an eye disease. This can be the percentage of patients who will become blind, or the time from diagnosis to blindness as an example. Well, there's a number of epidemiological variables that we can consider. Time, place, and person. So let's talk about time. Here's an example of the prevalence of myopia over time. The top image is actually the prevalence of myopia by age group as well as by different years, from 1971 to 1972 and 1999 to 2004. Here we can see the actual prevalence. That means the instance where somebody occurs to have myopia actually has been increasing over time. If you look down at the bottom row in black, that was from 1971 to 1972. Now in 1999 to 2004, we see the prevalence of myopia increasing, almost doubling actually at the rate. So we're expecting a lot more myopia as time goes on. Another thing we can think about with time is seasonality. An example of that might be allergic conjunctivitis. If we look over time, over the seasons, we can expect different incidents of disease. In this case, allergic conjunctivitis. We expect those more in April, March, when we have high pollen counts, and then later on in the fall, there's a second bump, really from mold. So this is one way you can actually use epidemiology in your practice, and the time component of it specifically is when you see a patient come in, is it likely that there's an allergy or not, can depend on the season. And so the amount of allergic conjunctivitis we see goes up in April, May, and goes down during the winter months. Thank you.